I was lap banded May 27th of 2006. So it's been a little over a year and 115 pounds later. And that's also with 2 fills. I lost maybe only about 20, 30 pounds without a fill. Sat stagnant for a couple of months. I figured I better get a fill. So I got my first fill, probably lost another 40, 50 pounds, and then really plateaued for about 3, 4 months there, and that's when I decided I better get a second fill. And I guess I dumped, another 50, 60 pounds, something like that. So here I am, and I think I'm right at the right spot. I'm losing like a pound or 2 a week. I had heard of the lap band probably 10, 12 years ago. I didn't look into it at the time. I also wasn't as heavy at the time, but I got heavier in the interim. And I remember stapling was all the rage back then, about 10, 12 years. But then I heard about all the repercussions and side effects that has, and mortality. And that's another thing too. The mortality rate, I think, is too high for the bypass. The key question to me on any surgery was, what's the mortality, fatality, and has there been any? And I was assured that there was none. In fact, I even contacted the Mexican Medical Association to check up on that. I went through something similar back in '97. I had my eyes lasered, and again, I didn't want to go to just any, not even an optometrist. I went to an ophthalmologist in case there was an accident or something like that. I mean, I want to make sure everything's right. I'd rather spend a few extra bucks if need be, but if not, then of course not. But I want to make sure the person is professional and experienced. And Kuri was all that, and then more. Well, it was 2 key factors. Okay, obviously the one is money. I mean, because at the time he just blew the doors off of everybody stateside. And 2 was, I don't want to say reputation, just experience. He was experienced, and I felt confident. I was pushing 400. I was like 390 something when I jumped into this and did it. And health-wise, I'm knock on wood, I was okay. My cholesterol was low. My blood pressure wasn't that bad. It was considered moderate. But I wanted to catch it before it did go bad. I healed very quickly, and I probably stayed on, went from liquids to soft half the amount of time that's specified, and to solids. But that's the beauty of the band. It's a tool. I try to watch what I eat, but sometimes I can't. I don't. I'm with a group of people. They want to stop at Joe Blow's fast food, so I'll stop there too. And the key is you eat less. Okay, so even though you're maybe not eating the best food, you're still eating less than you were before. And that's what's worked for me. It's easier to do a lot of things. Stamina, vigor, whatever you want to call it. I mean, I have to remind myself to eat sometimes. And I do notice that. Sometimes my energy, I start petering out at the end of the day, so I figure I better eat something here, or drink something. But yeah, I have a lot more on a lot less. It's amazing. Probably, because the body's not working as hard, you're not carrying as much weight. So I feel a lot better. And I actually can get up earlier in the morning too. One thing I noticed since I've lost weight, I don't want to sack out all day like I used to. I'm not as lazy. It works. I've mentioned it to a few of my friends. Dr. Kuri's a real deal. I'm glad I did it. He's great. He's got a great staff, great follow-up. I mean, any problems. I only had like one problem. I think I called up after the procedure, and he called me back almost immediately. A year later, my wife saw the fantastic results. She got it done. No problems. Everything was smooth. I'm glad it's done. If you're thinking of doing it, do it.